Well, good evening, everyone, and welcome to Health Disparities in Hampton Roads Community Forum. I'm Barbara Hamley. I'm the executive producer and host of Another View, heard on your NPR station for Hampton Roads, 89.5 WHRB FM, and I'm also the owner of Sharing Info LLC, which is a communications consulting company. I am so honored to serve as your MC and your moderator for this evening's critical conversation about healthcare disparities in the Hampton Roads area and what we all can do about the issues and how we all can come together. Now, we have a stellar panel of experts that will be joining us, talk to you a little bit about what their organizations are doing in the healthcare space. But this forum is for you, the community. We need to hear from you. What are your concerns? What are the issues that you're facing? What are the obstacles that you're facing? What are some of the things, some suggestions you may have to make gaining access to healthcare, participating in the healthcare process, making it better for yourself? So get ready to either type in your questions through the Q&A that you see if you are on our Blue Jeans format. If you're not on that format, then you may be joining us by Facebook. You can also send your questions through there, and we will try to get to as many questions as we can. So I'd like to start by introducing you to our panel, and I'm just going to go through their names and give you their titles first, and then we will hear from them individually. So first, and this is in alphabetical order, Dr. Augustine Austin Argo. He is the Provost and Vice President for Academic Affairs at Old Dominion University. Hello, you can wave, Dr. Argo. Dr. Jordan Asher, he is Senior Vice President and Chief Physician Executive at Centera Healthcare. Dr. Leonard Brown is Vice President for Norfolk State University Student Affairs, and he is their COVID Administrator. Dr. Michael Dacey is President and Chief Operating Officer of Riverside Health System. Dr. Richard V. Homan is President and Provost of Evms and Dean of the School of Medicine. And last but certainly not least, Tess Ledoux is a maternal and child health educator with the Peninsula Health District. So thank you all so much for joining us this evening. What we're going to do now, audience, is to hear a little bit from each of them about their organizations and the space that they take in the healthcare of Hampton Roads. So I'm going to start with Dr. Argo. And by the way, we did speak ahead of time, and everyone on the panel has given me permission to use their first name. So from now on, we will be using first names. So Austin, let's start with you.
Well, good evening. So again, my name is Austin Argo. I'm the provost at ODU. I just want to quickly mention that I'm really, pleased to be here this evening to participate and listen to the needs of our community. At ODU, we have roughly 24,500 students. And out of the 24,500 students, we have roughly 3,000 students who are enrolled in our health science programs, and we have roughly about 26 different health science programs ranging from public health, community health, dental hygiene, cytotechnology, nursing, biomedical sciences, and biomedical engineering and counseling. In addition to our degree programs, we also have some clinical services and 2 centers of excellence. We have a physical therapy clinic where students from ODU, Hampton University, Evms come to receive their clinical training. We also provide basic PT services. Some of our clients have health insurance, some don't, but we see everybody. On average, we have roughly about 3,000 clients per year. We also have a speech and hearing clinic, and we also see children as young as 2 years old to adults who are in their 60s and 70s. And what's very special or interesting about this clinic is that we work with several agencies, the community, and school systems to make sure that we're able to respond to the needs of our community. In addition to that, last year we established a Center for Telehealth, and as of date, we have provided training for over 500 faculty and students from ODU, Evms, Hampton University, so that they can learn how to provide health services using telehealth technology. And I would just want to mention real quick that a few days ago, President John Broderick and Norfolk State President Dr. Adams Augustine made a public statement regarding our joint desire and interest to establish a school of public health. There's a sense that there's an urgent need for us to partner with other higher education institutions in Hampton Roads and also community-based organizations to begin to find ways to address the health disparities that we all know too well in our community. So let me just conclude by saying that as a university, we have a very strong commitment to work with community-based organizations and healthcare institutions and other universities in the region to begin to address some of the complex health issues that we know that we must address.
Okay, thank you, Austin. We appreciate that. Dr. Ashton, Jordan Ashton? Asher,
very
pardon me.
It's okay. First names is how we're doing it, so that's great. First of all, thank all of you for being here, not only watching whether Facebook or on Blue Jeans, but this is an incredibly important conversation tonight. And Centera Healthcare obviously is a healthcare delivery organization, but we know that healthcare is just a small percentage of what makes up overall health and well-being. As we all know, socioeconomic factors, physical environment, and health behaviors really make up 80% of the overall health. Therefore, if Centera wants to really help with health and wellness, we've got to focus on working in and with the community to address the health disparities and other factors that affect individual health and the well-being of our community. And thank you all so much for being part of these conversations. We are committed to funding programs and being part of programs that address the underlying social determinants of health and really focusing on health equity. To that point, we are very much focused in our social responsibility and how to work with and invest in our communities across the state. This includes access to affordable housing, skills and career training, and addressing food insecurity, especially during these difficult times of COVID. Through our partnership with the Local Initiative Support Corporation, better known as LISC, we are investing $15 billion over the next 7 to 10 years to be matched dollar for dollar by LISC. This is really to go to support a number of crucial economic development initiatives like 757 Rebuild Hampton Roads Small Business Grant Program, which provides grant money to small businesses impacted by COVID. We also focus with LISC on preparing a workforce for quality jobs, support entrepreneurs, and promote access to career and technical training through 2 financial opportunity centers that were established this past year, 2020, knowing that financial opportunity is really at the base of a lot of what we need to do together, as well as build and grow local infrastructure programs, partners, and investments to propel our communities forward, like our work with LISC and city economic development departments to support small business development, especially in low-income neighborhoods. Though we've always known about work and work towards addressing these needs, COVID has really provided an even more heightened sense of urgency. Not only do we take care of people both with COVID and without COVID, especially at this busy time, we focused on spearheading the We Care COVID-19 Virginia Emergency Food Support Plan. We held educational calls with faith-based leaders and also provided over 15,000 free COVID testing to individuals, especially those that are most vulnerable. We worked with Norfolk Community Services Board to support their Healthy Hotel program for homeless patients during the pandemic. Obviously, as we talk about public health and health disparities, there's a lot that has to go on outside of COVID-19. And therefore, we recently announced the Centera Healthier Community Funds, which is $10 million in grants for public health and health equity initiatives, as well as the support of the formation of the School of Public Health that you just heard about. We also recently began partnering with the American Heart Association's Empowered program, which provides a Well Healthier Church challenge to local faith communities. We continue to provide other preventative screenings as well as everyday care for cancer, flu, diabetes, hypertension, etc., especially working with the NAACP, Urban League, the Hispanic Resource Center, Hampton Roads Pride, and local faith-based organizations, as well as our other community partners, such that are participants this evening. The Centera Ambulatory Care Clinic in Norfolk serves the medical home for indigent and Medicaid patients assigned through the emergency departments, and this is in partnership with Eastern Virginia Medical School. We continue to fulfill our mission to delivering care every day by not only delivering that care, but also focusing on the health and wellness, especially for those that are most underserved. Thank you.
Okay, thank you very much. We appreciate that. Dr. Leonard Brown. Leonard?
Hello, everyone. My name is Leonard Brown, and I serve as the Vice President for Student Affairs at Norfolk State University. In addition to overseeing student affairs and the close to 2,000 students we have living on campus, I also serve as NSU's COVID-19 Director. Despite the challenges that this institution, our country, and world are facing at this moment as it relates to COVID-19, I couldn't be happier to be at NSU and work with a tremendous faculty and staff who are dedicated to the student success and wellness both in and out of the classroom. This, of course, takes into consideration the important role that we play in this community and the Hampton Roads area. Last fall, NSU celebrated its 85th anniversary as a higher education institution in the Commonwealth, and the Spartan tradition runs deep not only in Hampton Roads, but across the world. Alumni from this institution have gone on to work in careers to serve the greater good in both the public and private sector. Many of our alumni have made contributions to society that embody some of our core values, which are student excellence, diversity and inclusion, integrity and civility, engagement, pride, and financial empowerment. We are proud of them for the work they have done and will continue to do. We're also proud of our future graduates for their scholarship and tenacity, their ideas and creativity, their respect for community and dedication to service, and for all they will do to help make this world a better place for everyone to work, live, and thrive. Historically, Black colleges and universities like Norfolk State University help produce more than 20% of all Black African American graduates in the United States. We play a vital role in STEM education and the representation of minorities who major in those fields. We also have a robust offering of programs in our College of Liberal Arts, and we are one of the few places in the state where you can earn a bachelor's, master's, and doctoral degree in social work at the same institution. As mentioned previously by my colleague, the establishment of the recent announcement of the establishment of the Joint School of Public Health is one example of some of the things that we are doing specifically to address health disparities and address COVID-19 pandemic. We have numerous other community partnerships, and we offer a world-class faculty really that allow us to work in the community, with the community, to help address this pandemic in the best way that we can. I'm very happy to represent NSU, very happy to be on the panel this evening, and look forward to the discussion.
Okay, thank you, Leonard. Dr. Michael Dacey.
Yes, ma'am. Thank you very much. Just a minute or two on Riverside. So Riverside, as I think most people know, is a health system that's been around for 105 years, and we have 5 hospitals. spread across a wide area, but based in the largest hospital in Newport News. We also have a school of health sciences where we educate nurses, various medical technical people, and that's been a very important part of what we do. We also have medical education residencies in family medicine and emergency medicine and different types of internships for physicians. And we also support a number of free clinics throughout the region as well, both with staffing and financial support. Some of the most important things we do for the area and for the community relate to trauma. So as many people know, trauma disproportionately affects people who are in economically challenged areas. And so we are very proud of the work that our trauma center does, and very proud of the work overall, particularly that the people have done over the course of the last year or so. I mean, everybody in healthcare has developed, I think, a new pride for the work that they do, whether it be in the education portion of healthcare or the care delivery portion. So we're very proud of being a part of the community and very pleased to be here tonight. We look forward to the discussion. Thank you.
Thank you. I appreciate that. I'm going to switch it up just a little bit. And Tess, I'm going to come to you. Tess Ledoux with Peninsula Health District.
Can you hear me?
Yeah, there we go.
Awesome. Hi. So the Peninsula Health Department, we have various clinics. We work to, have the car seat program, the pack and play program, and we have family planning and prep services for our mothers. But besides that, specifically in population health, specifically before COVID, a lot of different programs that we were actively working on to address health disparities. One that we've been trying to get up and running again, because I believe it's incredibly important, is the Perinatal Periods of Risk Project. It actively engages and involves our community by essentially saying, what programs do you like to see? What do you want to see? Especially because a lot of times, the health department or other organizations in general will decide what an issue is that we see needs to be addressed, which can be helpful, but maybe not sustainable in the long run. And the perinatal periods of risk, it's very heavily data-driven, but community-focused, and the community can decide what they want to see in the future and how they want to enact it. And it's really working with all of these wonderful community programs, while at the same time working with, moms and dads even in the community, so that we can get these partnerships and programs off the ground. We're also working on a health opportunity, so that we can also see the data even more within our community and see where preterm births are very specific to our area, as well as the reproductive justice limit across the Peninsula Health Department, which is just having this understanding that a lot of times we want to see the people who are affected by problems being the ones that are put in the position where they can, find the solution with the assistance and support of. So that's kind of what the Population Health Department within the Peninsula Health Department is working on. And I'm really excited to be a part of it, and really excited to work with the community to help us with these programs. So if anybody here is, then I would be happy to have their information, or I can give my email out as well.
Okay, we can do that a little bit later on. Thank you. We appreciate that. And last but not least, Dr. Homan. Richard?
Thank you, Barbara. And I want to welcome everyone to this evening's program and thank all the participants as well. We have some of the premier academic and clinical institutions in this community. And our hope tonight is to be able to provide opportunities for us to work better and more coordinated ways to be able to improve the health of the region. EVMS was started by the community for the community, and we have never forgotten those roots. And so consequently, we have as our touchstone ways to be able to improve the health of this region, create the workforce for this region, and lead to new knowledge that creates opportunities to be able to improve the health, not only in Hampton Roads and Virginia, but around the world. So we have three core missions at EVMS. First is in education, and we have a medical school. EVMS actually understates what we do. We have a medical school with 600 students to train the next generation of physicians. And then after they graduate from medical school, we have 360 positions for subspecialties in over 30 specialties in OBGYN, surgery, in critical care medicine, and many others. And then we also have a school of health professions. And that school actually has more students than the medical school. It has over almost 850 students now, with programs in the physician assistance program, surgical assistants, MPH for public health, and PhDs in biomedical sciences, and many more. And we've aligned all of those to identify better ways for us to be able to meet the needs of our community. Our educational program has a very comprehensive community engaged learning track. We've had over 100,000 volunteer hours by our students. As we speak, actually, we've trained 100 students to be vaccinators in this region, and we anticipate another 100 to be trained. So we have a little army that can go out and help in all of the communities in Hampton Roads to provide opportunities for the vaccine to be distributed much more effectively. We also have a research component for reproductive medicine, cancer biology, and we work collaboratively with Centera and other health systems in looking to find ways to be able to make healthcare more efficient, and opportunities that we can develop to be able to generate more opportunities for care in the region. And our physicians care for over 400,000 patients a year. We have over 200 providers as part of our medical school. So again, I want to thank all the participants, Barbara, for your moderating, but more importantly, we want to listen. It's time now for us to listen and get the wisdom of the community to identify how we can collectively help improve the health of Hampton Roads. So thank you.
Absolutely. Thank you. I appreciate that. So audience, it is now your turn. We've gotten a lot of questions in already. So I'm going to start with some. If we could bring up the, thank you, so I could see everyone. And each of you, while each of you could answer any of these questions, I'm going to kind of dance around so that we can get as many in as possible. So the first question comes from Sinclair. He says, it is very difficult for many low-income people to get themselves to healthcare facilities. What are you doing to bring healthcare to the people who need it? Let me start with you, Mike, over on the peninsula. What are you guys doing at Riverside?
So it's certainly an area that we're concerned about. One of the things we're trying to do is to, through our support of the free clinics, bring the care closer to the patients. Certainly in terms of providing clinic resources that are actually on public transit routes. We're trying to establish new resources there, but I think it is, in all honesty, an under-addressed issue. And if you can't get to the care, you can't get the care. And I think it does require a more concerted effort amongst the health systems and the public health agencies in the area. And we'd be happy to cooperate in that. But I agree, it's certainly an under-addressed issue, and more work needs to be done on it.
Okay. This question I'm going to ask of both Jordan and Richard. It is from Trevor Lyford. He says, it's been found that some of the worst life expectancies in Hampton Roads and Virginia as a whole are found right here in EVMS and Centera's backyard. With recent publications on housing segregation in Norfolk, what are EVMS and Centera doing to help reach these communities and improve outcomes? Richard, let's start with you.
Certainly, and you're right. The health metrics at Hampton Roads really are in some ways embarrassing, frankly. We have a very high infant mortality rate, maternal mortality rate, the rates for prostate cancer, breast cancer, colon cancer. And we have taken opportunities to be able to train the next generation to be sensitive to that and to be trained to be able to create opportunities to know the community as well as to take care of the patient. So the individual patient, how to take care of the patient, but we have a community engaged learning track so all of our students understand what it is in the community, that how they can make a difference in their future practice. We do have free clinics that the students put on called the Hopes Clinic and Esperanza Clinic. We take care of the safety net patients through our clinical practices. We have about 25 sites throughout the region, but we need to have more of a coordinated effort among all of our health systems and identify ways to be more efficient. It's not only just about the physician, it's about other healthcare professionals, about social workers, about public health officials, to work in a very team-oriented fashion to be able to identify ways where we can really improve the health, especially of those that are in need of it most.
Okay. And Jordan, I'm going to ask you the same question since they mentioned
Sure.
EVMS and Centera specifically.
Sure, and I do want to give an example that sort of ties in the other question as well. For example, the point of how do you get health care to local to improve outcomes is incredibly important, because just having you come to me doesn't work. And so, for example, we're working with EVMS and their medical students along with ODU to, in fact, bring healthcare via telehealth into underserved areas. So instead of just trying to do the clinics and everything, which is all great, how do we go further? So there's a lot of screening that happens, but once I screen you, that's only part of it. If I screen you for high blood pressure and I find it and then give you a card of where to go, that doesn't work. So therefore, we're saying, okay, how do we diagnose you right there? Then via telehealth, working with medical students in the clinic I talked about earlier, how do we immediately get you care? So that's just one example of how this comes together. But I think more importantly, we have to really address the root causes of a lot of these issues. And that's really those health determinants. I can't solve your healthcare problems until I solve your diseases of life. And how do I really impact that? And just as Dr. Rick said, how do we all come together working as a community to solve community issues? We can look at what the numbers are, and they are not good. And what we really need to do is focus on how do we come together to work together. Lots of people are doing lots of things, but unfortunately, we're not making great progress. So how do we look at it differently? How do we think about things differently? And how do we leverage the advantage of everything we have, whether it be the work at NSU, at ODU, at health systems like us in Riverside, healthcare universities like EVMS, and the health department. It's incredibly important. And that's why we are trying to have these conversations to further that initiative.
Austin and Leonard, your students, do you talk about the social determinants of health? Is that a part of the curriculum? And has that changed over the years in terms of the way that you're training people to be able to work in the healthcare field effectively?
Yes,
Austin, let's start with you.
Yeah, I can go first. So especially in one of the health science programs, physical therapy, occupational therapy, and public health, the community health, that is really a key message or knowledge that we want our students to have. As been said, so a lot of the health issues that we deal with in our community is not just waiting for people to get sick before we provide healthcare. There are a lot of things that we can do and train people to do to take care of themselves. It's managing your blood pressure, the exercise, your diet, where you live. So there are a lot of things that we can be doing as individuals to make sure that we have good health. And that's the knowledge that our students have. The one thing I probably should mention also, we have a lot of our students and faculty working out in the community to provide health information. Again, information that they can use to help them to stay well.
Okay. And Leonard, your same question to you.
Yeah, a similar answer, but specifically being a historically Black college and university, that's at the core of our mission. And the programs that we have, in health services and health management, our nursing, healthcare administration, all of those things are really driven, again, by our faculty who are keenly aware of those issues and know the importance of that being a critical aspect of the educational process for our students, so that they take that knowledge and really put that in place in practice as they are active in the medical field.
Okay. Tess, this one is for you. This comes from Stephanie Spencer. She says, I'm the executive director of Urban Baby Beginnings. We provide home visiting and community-based doula support. What are your maternal health priorities, and how are you partnering with community-based organizations to help provide additional social support to pregnant and postpartum families. Sorry.
I love that question. Oh gosh, good. So we partner with Smart Beginnings on the Virginia Peninsula. I work with them on their health working group as well as their data action team. So we are on the collective impact, essentially, where we work actively with the community, with mothers, and we just try and look at how we can bring all of our community partners together so that we're working towards the same thing. We're all saying the same thing. We are looking at social determinants of health. We're looking at those community factors. We are looking and seeing and talking to these moms and saying, who else do we need to have at the table? Who else should be here? And what do you want to see happen? And with that said, obviously, health is a very weak determinant, and healthcare is a weak determinant of overall capital H health. Education, all of those things are really important. Health and all policies should be our main fact that we are considering. And so that we're currently engaging with. And I think it's really important that we continue to make partnerships across the community because like Jordan said, we can't do anything alone. We have to be partners here because if we all try and do the same thing and duplicate efforts, then we're just going to be spinning our wheels.
Okay, there is a question from, from Maya from ODU. She says, hello, where can the most recent data on health disparities be found? Let's see, let's go to an academic on that one. How about Leonard? Let's start with you. Any suggestions on where she can go to find the most recent data? Or who else has,
I do.
Richard? Okay, go ahead, Richard.
Comes from the Health Department, the Virginia Department of Health, the CDC, the Agency for Healthcare Research. Those are all nationally and statewide databases that you can query. You can actually drill down to the nearest zip code. And we're doing that now. We established a new Center for Maternal and Child Health, and we're going to be looking to identify where the most vulnerable communities are so we can find ways to be able to case manage those patients more efficiently. So there is an enormous amount of data. What we have to do is drill through it and then translate it into action and find ways to then coordinate our efforts to be able to improve those metrics. But those are the three, I'd say, major areas for people to research in order to get some of the data granularly in this region and others throughout the state and nationally.
And those of you who are listening and watching, if you have suggestions on areas that you think are of major concern within Hampton Roads, that's what the panel needs to hear. They're looking to you not only to answer your questions, but also to receive some guidance and some information from you so that they can go back and start to plan and make things better for our area. From our Facebook, Levon Pledger asks, what service model and areas can we expect for neighborhoods like St. Paul's in Norfolk? Will this include wraparound services with other organizations? Who wants to take that one? Jordan?
Sure. And so it brings us back to the conversation earlier. And I think the most important part about that question is the wraparound services. Because sure, we could go and bring telehealth, give health care, but if I don't give you access to food or healthy eating, that becomes a problem. Also, a major focus that I want to bring up, and I read one of these other questions, has to do with health literacy. We talk a lot about education, but we don't necessarily talk about literacy, which is very different. And for me to really be able to help to help you help yourself, as someone mentioned, I think, Leonard, I think you mentioned that, it's important that we understand health literacy and how do we activate and engage people to do that. How do we work with our faith-based community on that component? How do we bring them into the conversation? And so organizations like Healthier 757, where we are all part of, we're all working together to improve not only your health, but your health literacy. Because as Tess mentioned, there are lots of different components that make up the dynamics that are needed to improve your health and wellness.
Okay, we got a bunch of questions here, so I'm trying to go through them as quickly as I can. This one, I think, Richard, is coming to you. As a chronically ill individual in Hampton Roads, when I was seeking a diagnosis, I was frequently turned away by local physicians who felt my symptoms weren't real. What is EVMS/Centera doing to advocate for patients and for disabled and chronically ill communities?
I think that's a great question because it speaks to the heart of the issue about disparities and finding ways to be able to have the physicians and providers understand where the patients are and meet them where they are, and to be able to help to care for them and heal them. We try to do that in a number of ways. One is by training our students to be able to be recognizing that. We have a whole curriculum on cultural humility to identify ways now to be able to understand different cultures, different issues related to different people that don't look like you or don't have the same privilege that you may have, and how can you meet them in a way that you can be a healer as well as a clinician and provider. So I think it's important for you to identify physicians that are willing to listen. And this is a night where we're listening to you. It's almost a metaphor in medicine where I, as a physician, if I let the patient talk, they'll tell me what's wrong. The history makes the diagnosis 80% of the time. We're listening to you, and you need to find a clinician, a doctor that's willing, or PA, or nurse practitioner, that's willing to listen and understand you as a human being, and through that process, you can heal. Well, there are many great physicians and nurse practitioners, PAs we have in this community, and we hope to be able to connect some of you with better access points so you have the ability to be able to get the care that you need and deserve.
Hey, Barbara, can I add something to that?
Oh, yes, absolutely, Mike.
So I think that also part of this is a cultural education. So when I went to medical school, I went to medical school in DC at GW, and we really did not have at that time, and it was a few years ago, I really didn't have any kind of education on different cultures in medicine and how it affects how you deliver care. So I think increasingly with that, across from whether it be the medical school or Centera's education programs or Riverside's education programs, we try and incorporate that into how the students learn.
Mm-hmm.
But I'm just really also.
Go ahead, Jordan. You had. Oh, I'm sorry.
I think Austin.
That is Austin. So I think just one point I want to emphasize is that as patients, we also have to advocate for ourselves. Physicians, obviously, they are there to help us, but we also have to make sure that when we do see a provider who's not willing or demonstrate that they really don't have the cultural competency to meet our needs, it's okay to look for somebody else who will actually listen to you.
Absolutely. This question is another one from Facebook. Deborah Fisher asks, seeing that there are such significant health disparities in our communities, what new programs are being established to educate the public on preventing them from getting sick in the first place? And I'm going to add on to that for just a little bit. And Mike, I'm coming to you. But also, if they're not new programs, are there different ways that you need to be promoting the programs to let people know that you're already in the space? So let's start with you, Mike.
Yeah, I think that this is an opportunity, this kind of a problem for charitable organizations to work with health systems for specific problems. For example, at Riverside, we've worked with 100 Black men on prostate cancer and both awareness and screening. Huge problem in the African American population and as people get older. And that's had real tangible success in terms of picking up cancer much earlier and at a point where it can actually be cured. So I think charitable organizations working with health systems and the medical school as a bridge between people and healthcare delivery. And that's just one example. I'm sure Centera and the medical school have others.
Yeah, and I'd like to layer on. We have to remember, we have to think about this in the context of human behavior. And especially when we're dealing with health disparities, the issue of trust is a big one. And so as a healthcare provider, I can provide care all day long in education. But if you don't trust me and you don't get your information in the way you want to get your information, it becomes very problematic. And therefore, we have to think about ways and work in different ways to not only provide that trust and increase that trust, but meet you where you are in your information. And interestingly enough, I was doing one of these the other night, and it's amazing how many people get their information through the library, even their health information. And librarians are effectively healthcare givers. And how do we do that? Barbershops for African American males and hypertension and prostate. Lots of different ways. What is the way you want to be spoken to? How do you want to be spoken to? And then how do we get that information to you in that way, and working with your trusted voice? And it's interesting because when you do a survey of where do people go to get trusted information, what's the number one answer? Friends and family. Not websites, not WebMD, not Centera website, not Riverside website, but friends and family. So we have to think about health information, health education, health literacy within the context of who you are and how you get your information.
Tessa, you also partnering a lot with outside agencies, particularly when it comes to the maternal healthcare disparities, and how are you getting the word out that the health department actually has the programs that you have?
So we partner a lot, like I said, with Smart Beginnings, and their universal screening program has assisted us a lot with that. We also, have our website, our social media, but I think we could do a lot better. Getting our programs out is something, that advertising of that is something that I think is crucial to our populations. And I just wanted to touch on really quickly the question of what programs are out there. There is one that I just want to speak to really quickly because in this context, Postpartum Support Virginia, especially now with COVID, pregnancy, the state of the world in general can just be hard. And so, they do a really great job of helping mothers. And I think that, if anybody needs assistance with that, they should really check out Postpartum Support. They currently do virtual support groups at this time, but they're a really great agency.
Okay. We have somebody else wanted to speak. I'm sorry. Austin?
I just want to mention, so in terms of new programs, last year at ODU, we established an interprofessional health education and research center. Essentially, it's a group of faculty and students from human services, physical therapy, dental hygiene, and nursing, working together to help our community, especially the uninsured and underinsured, to help them to access medication and provide the mental health information, and also, help them, especially those who may qualify for Medicaid, but really don't know that they qualify. So you help them to complete the process so they can qualify and be able to use that services that is available to them.
Okay. I have a question from Angela Mercer. Jordan, this one is coming specifically to you. How can a local medical society comprised of predominantly African American physicians access funding from Centera for a health literacy program we have designed?
That's a great question. I almost tried to answer it because I saw that question come up. The easy answer for that is contact me. I will definitely help you with that.
Okay, there you go, Dr. Mercer. This is a theme. I want to read two questions that basically kind of encapsulate what several people have been asking. So, trust with underserved populations. So the first question is, this pandemic has highlighted the tremendous chasm of trust between underserved populations and major healthcare institutions. What can Centera do to bridge the trust problem? And then from Facebook, as a follow-up, Amy Paulson with Cinch asks, can we talk about the importance of comprehensive implicit bias training for healthcare providers and staff at all levels? To what degree are we truly adequately training everyone from the front desk staff to our physicians? And I actually want to go to Mike, Jordan, and Leonard, and Richard. I'm going to let everybody answer these questions because this whole idea of trust, building trust, and implicit bias, explicit bias all plays into how people feel about going to get their health care and how they are receiving the information that you all are trying to provide. So, Richard, let's start with you this time.
Well, I think it's even more acute as we speak today because the COVID pandemic is affecting the African American communities adversely. I mean, there are many more complications, more deaths, hospitalizations, and morbidity among the African American community. And regrettably, they don't have trust in the vaccine because of historical data that occurred many years ago. And there's a sense that perhaps it isn't effective or perhaps the government has created it. And there's a little skepticism there. So one thing I'd like to do tonight is just try to encourage everyone in the community to get vaccinated, talk to your physician or your provider. And then EVMS is also going to be rolling out some public service announcements to try to provide assurances to among people of color, though, that demonstrate that they're taking the vaccine, that it is something that should be done to provide some assurance and trust that this is a time when it is important to protect your families and yourselves from this disease, and we do have an effective opportunity to prevent it.
Leonard, is this a golden opportunity for historically Black colleges and universities to step in to help with that type of training in terms of bias and implicit bias from the front desk through the musicians as physicians, as the questioner asked?
I think it is absolutely an opportunity. I think specific to the pandemic and the history, given the relationship with our community and the medical field. One of the things that we're doing at Norfolk is designing really a series of internal programs, not only for our students who are going into the medical field, but across the campus. And the idea is to look specifically at what that history is, so that we can fully acknowledge and be transparent about it. And then to follow that up with some frank discussions on this current vaccination, the process, trying to debunk some of the myths, but providing information so individuals can make decisions on their own. And again, I would just emphasize, because of the mission of being a historically Black college and university, these are the types of practices that are critical for us, for people. Again, we're training to head into the medical field, but across our community as well.
Okay, Mike?
Yes, ma'am. So we try at Riverside to go directly to our physicians, and sometimes you find it seems odd, but physicians, particularly those that haven't grown up in a diverse community, they really don't understand the importance and some of the hesitancy that African American people and other Latinos and other people have towards accessing the healthcare system. The vaccines are just the tip of the iceberg. The same thing goes for all kinds of things in hospitals and healthcare. So educating the physicians and trying to bring them along is a very important part of what we do. And we think it's important that we try and understand the perspective of the populations that we serve, because there are many times where people are very, very intelligent. It's not that they're not educated. People understand it very well. My spouse is African American, and we talk all the time about vaccine problems and why it is that African Americans are more hesitant. And she said we need to educate people. It's just not. We're very intelligent people. We know exactly. We've read the websites. We've read everything about how efficacious the vaccine is. We just have some concern and hesitancy because of things in the past, and you need to understand that, but also continue to engage us, and so be proactive in understanding it, and don't be judgmental in that. I think that's a very important thing, that we need to be proactive and engage, and don't be judgmental in terms of that, because there's a lot of history, and it's real history, and we need to understand that.
Jordan, even before somebody gets to the doctor, though, they've got to go through that front desk person. Then they've got to go through the nurse, the triage nurse, or PA who checks them in, et cetera, et cetera. And if you're getting feedback from any of those levels prior to getting to that physician that may be culturally sensitive, you've got an even higher mountain to climb in order to overcome that person's issues.
Absolutely. And I want to get to your trust question as well, because I think these are all tied together. Is to be real honest, that lack of trust happens before that door is even opened, right? So you've got it sitting there, and then you've got the implicit biases, and you've got the cultural differences that all build up. So the first step is, just like any good situation, is I've got to be aware of the issue. I can't change anything unless I become aware of it. And so therefore, how we do that, whether you could get into, from an educational standpoint, simulation conversations, which are very important and are going on in training. And that, to your point, Barbara, that has to be at every step of the way, because if one of those falls down, it all gets wrapped around in that mistrust. But when we also think about trust, we also have to think about the messages, who is giving the message, and how it is delivered. So, for example, when we did our COVID testing, we set up everything, and we went to our first location in the St. Paul area, and only 6 people came out. Okay, and we're going, what did we do? What is going on? Well, as it turns out, it's because we decided not to have anything with any branding on it, so we showed up in a white van to do the testing. And we learned that we can't show up in a white van because there are people worried about being deported. And we had to learn that. We had to learn that you could not have security there because people were worried about the justice system, and that we were really there to create a situation for that social justice issue. So we have to continuously learn whether you want to call those biases or not, situations. And then who gives the message is very important. We were talking about before we started how you had Dr. Newby on today. And so we are working very closely with Dr. Newby on the vaccination, because Dr. Newby has a much better chance of getting people vaccinated in the Black and brown communities than I do. Okay, I can't change how I look. I can't change that underlying biases of anything. And so we are very focused on those issues, because we've got to earn that trust back. And earning that trust is by actions, not words. It's by who is giving the messages. How are we working with them? How do we show up? To your point, how do we get our staff attuned to the situations and be aware?
Okay, apparently we have struck a nerve here. I'm just looking through some of the other questions that are coming up, but I want to give Tess and Austin a chance to answer if you wanted to add anything to what's been said before we move on to the next question. Austin?
Yes, so I do. So there are other 2 ways to look at the issue of trust and implicit bias. When we look at it from the standpoint of what we do as a university, one of these is that we have to make sure that in our curriculum, we make sure that we help students to have the cultural competency to be able to work with diverse community. The other piece that's very, very important also is that we have to make sure that the students we admit to our program, that we're able to produce students and graduates who also look like our community. So if you have a degree program in nursing, medicine, PA, where all of the students are from one segment of our population, we will have missed an opportunity to be responsive to our community. So as a university at ODU, we make sure, and when we admit students to our nursing program, our physical therapy program, that we have a very diverse group of students, so they also will look like the community that they will be serving.
Okay, and Tess, anything you want to add?
I really just wanted to speak again to cultural competency. This is why I really love public health, because truly it's about meeting the community and the healthcare system, halfway, and understanding that the community and what they had to say, what a mother has to say, and her feelings, her beliefs are equally important. So that's why you can see doulas are really important, especially to our Black mothers. And that is so important and very valid. And we need to make sure and understand, especially major healthcare systems and the health department, that we, that and that we use that as part of our practice as it's being used in a very healthy way. And so I think that that is very important as well, that we don't walk over our communities, especially our communities of color.
This one is a question about access from Adrian Warren. He says, everyone needs a PCP, to a personal care physician, to develop a relationship with, to provide and coordinate medical care. But there's not much access for patients when many providers are overtaxed and wait times for an appointment with a new provider are generally booked 60 to 90 days out. How can access to PCPs be improved? Who wants to take that one on?
One thing.
Mike. No, Mike, please.
I was just going to say, there's no doubt there's a shortage of primary care physicians across the country. And one way that we're dealing with that is to use advanced practice providers such as nurse practitioners and physician's assistants as a force multiplier for the primary care doctors. So the nurse practitioner and the physician assistants will see the patients intermittently, and then the physician will, it allows them to see more patients on a monthly basis. And so that's one way. And but we are desperately trying to recruit primary care doctors. I'm sure Centara is the same, and there's a huge shortage. So we all need to think about ways that we can be more innovative. And as Dr. Asher said, telemedicine may be a way to help with that.
I would make too that we create the next generation of primary care physicians here too through our training programs, and we want them to stay in Hampton Roads. We don't want them to go to Northern Virginia or to North Carolina. Many of them are from this region. Almost 75% of the PAs we trained in this region are from EVMS. 25% of physicians were trained here. So we welcome the opportunity for all the health systems to recruit from our residency programs because they're extraordinarily well trained. They love the region, and all things being equal, I think they'd rather stay here, but sometimes it gets swept out for other family reasons or other issues. But we want them to stay in this region to have better access for our patients.
Okay.
And Barbara, do you? Mm-hmm. Yeah. And I'm gonna challenge us to even think even bigger than that. And that is, we have to remember that primary care services that are needed and primary care physicians don't necessarily have to be the same thing. And so when we think about what is needed for primary care, we have historically thought about it within the context it needs to be done by a physician or an AP or advanced practitioner in primary care. But there are a lot of things that we can do by creating the workforce of the future that focuses on those things. And that way we can really use our resources a lot better. And so that's what's so exciting about working on these public health issues with the universities and the health systems coming together, is we begin to think about those things very differently. We can think about, okay, what are the primary care services that are needed? How do we deliver those? And then where does the primary care physician / APP or advanced practice nurse or whatever it might be fit in? And how do you recreate it? Because if we keep everything centered historically how we have done it, we will get to the same result. Because to Mike's point, we will never be able to produce enough of that, and it will just be very difficult. So we have to think very differently about primary care services that are needed, and then the primary care physicians.
Well, and to piggyback on that, this takes it even a step further. This is an anonymous message, but says decades of mistrust need to be heard and valued, which we talked about, a commitment to include people of color in real leadership roles and not just continuing to go to the community for free help. We have leaders waiting to be invited to the table. So in other words, what are we doing also about leadership within health organizations, within organizations that are training others, so that you have that leadership at the top as well as throughout the rest of the organization? Who wants to take that one on?
Well, I'm the one who's responsible for training the next generation, and we have a core value in our school. We never had a diversity and inclusion VP. We hired one when I first came here 9 years ago, And we've developed a holistic review process to be able to get more minority and disadvantaged students in the medical school and the health professions. And now we're identified as one of the leaders in the country. And it's through that pipeline over time, working with our outreach to Portsmouth High School, for instance, where we have, and Maury High School, to get students involved in the health professions, to be able to use a pipeline. We have relationship with Norfolk State, with Hampton University, with ODU, and the undergraduate programs to then get them into one of the health professions or medicine. And then when they're in these schools, we have to ensure that they can feel supported and have faculty members and opportunities to feel welcomed. And I think we do. This school has been extraordinarily, advanced. We received a national award just 2 years ago from the National Associated Diversity and Inclusion officers. And I think we have a lot to offer. I don't think it's been publicized in the region, but this is a core value of EVMS. It goes back to where we were started by the community for the community. And that we want to make sure that our faculty, staff, and students look like the community. And so it is diverse and it reflects the population we want to serve.
Tess, it seems like, and this is me looking from the outside in, but the public health arena seems to have a lot of leadership, of minority leadership. Am I incorrect in that? Or is it just in the Hampton Roads area?
There is a lot of minority leadership in public health, but I would always say that there could be more. There's always room for more minority representation, more Black and Brown women, more Black and Brown men. That's always, something that is important, and there's always space. And so I think that it's our responsibility to make space. And I think that that is important to consider. I don't want to offend anybody, but look at our makeup right here. And I think that that's something that we have to consider, right? We're talking about what we want to do for the community, especially our community of color. And I'm a white woman. And so I think even though I have important ideas, we should definitely have people that are representative of our population that are, here and representing.
Go ahead, Jordan.
And to that point, I think it's not only in our leadership, because Centera also is very focused on diversity and inclusion. I know Riverside is as well. There's a lot of work to do there, but it's also having a voice at the table in all different things. We think about this on the patient side. Every meeting that we have a chair that represents the patient, okay? And so in every situation, we try to really work on how do we make sure that we think about that and get that voice in however we can. Because at the end of the day, Tess and myself and Dr. Homan, yes, even though we might be white, and have implicit biases due to that possibly, we still want to create a greater good and work with everybody. And so how do we think about that continuously in both directions? And Mike, sorry. Sorry about that, to make sure that we work on that, because we are a community of colors, and how do we use that to our advantage versus continuing looking at it as barriers?
This question is from Keith Jones. The biggest determinant of healthcare disparities is access to care. What can Centera do to go out into communities such as the Bon Secours Caravan? We know that service is costly, but it's also effective in taking care into underserved communities. This takes a proactive mindset. I'm going to expand it beyond just Centera, but and Mike, I don't know if Riverside, if you guys have like a medical van that goes into the communities to provide medical services, taking the medicine to the people rather than having them come to you.
So we don't have a medical van. We do have a mobile vaccination site that we're starting to use, and we're thinking in the weeks to come that'll be very useful for getting vaccinations to people in underserved communities. I think the idea of a mobile transport clinic is a very good one, and something we certainly will look into. Absolutely.
Okay. Jordan, you want to?
Sure. We have mobile clinics, but we also have to remember that helps a little bit at a time, right? So we also have to think about how do you stand up support systems in those areas versus something that just comes in and then goes out, right? Because that's the definition of mobile. It comes in and it goes out. Versus how does it come in and stay? How do you build that local infrastructure? How do you create healthy living areas? Because it hasn't come up yet, but it will. That one of the key bases to this is housing and living. How do you create those communities with mixed housing where you begin to really change the shape of all of this? And so, yes, we will all continue to use all these resources, mobile, telehealth, everything that's been mentioned, but we're also very focused on working together because I'm hearing a lot of these root cause issues. And instead of just trying to chew around the edges, how do we get at those root cause issues, whether it be access, affordability, quality, and transportation, whatever those root causes are, trust being the big theme of today.
You know, one of the other things we've worked on is we haven't talked about is nutrition and food insecurity. And so I know that Centara and Riverside have done some work working together as part of the community health needs assessment that we've all done about food insecurity and providing boxed meals to people, particularly vulnerable people. I mean, if you don't have good nutrition, you don't have good health. And so that's got to be another area of focus for sure.
Absolutely. Okay, this one is from Rodney Jordan, who's on the Norfolk School Board. What pathways or funding or co-ops exist at the health institutions to grow the pipeline of students of color into the health fields? How do we grow and expand, for example, EVMS at at Norfolk Public Schools? We need investments in our schools with high concentrations of students of color and low-income students. And I want to explain that out to the two universities also in terms of your recruitment from the high school. I know EVMS has a program with some of the high schools, but what are you guys doing to make sure that you're recruiting and bringing in students from the local school systems into your healthcare programs? Leonard, let's start with you.
Sure. So I think that one of the things that we're doing at NSU important is trying to identify in the local area, but also outside of the area, specific schools that we will have relationships with to recruit students. I think it's important to also remember, and I maybe I'm commenting on another question about elite students, that specifically at NSU, you know, one of the things that we say all the time is that we see the future in you, and we use that because we pride ourselves really on helping students access an education regardless of, you know, what means they have. Most of our students that come to NSU, you know, are not coming from lots of money, at least as that question indicated. But to get specifically back to this question, what we are doing, it is developing individual relationships with area schools to make sure that those students know that an NSU experience is something that is absolutely accessible to them and something that can be transformational for them.
So it sounds like you and Rodney Jordan need to have a conversation.
Yes.
At some point in time, absolutely. Austin, did you want to add anything to that before I'm going to go on to a couple of other questions before we start to run out of time?
So let me just say this. At ODU, over 80% of our students are residents of the Commonwealth of Virginia. And in terms of diversity, we have a very high percentage of underrepresented minorities, and those who are first in their family to attend the college. In the School of Public Health, I would say roughly about 70% of Ohio are students of color. And we work heavily with schools in Norfolk, Suffolk, to reach out to high school students to encourage them to consider ODU as the university of first choice. So we have done well over the years to engage with public schools here in Norfolk and also in Suffolk. So obviously, there's always more work that one can do to increase that percentage.
Okay, Richard, I think this one I'm going to ask of you. This is Tyra Owens is asking, are there any incentives and or programs that can help the students financially be able to afford these healthcare and medical school programs, especially since they are being used to assist in helping with these healthcare disparities?
Well, regrettably, we don't have a lot of scholarship dollars at EVMS. We're working really hard to try to increase that because scholarships dollars are an ability, as both Austin and Leonard mentioned, is that the students come from disadvantaged backgrounds, and it's very scary to go into a health professional program that has expensive tuition. So that's one thing. There are scholarships available, though. We admit many through the military. There are military scholarships that students come, and we're one of the highest percentages of because we have a large veteran and military presence here. Again, reflecting the community we serve, and there's scholarships that are provided through that process. I was a recipient of a scholarship because I didn't have it. I've been on my own since I was 16, essentially, and so I went through the National Health Service Corps and spent years on a Native American reservation delivering care. Great experience. Great experience to be a minority among Apaches. Okay, it definitely provides an opportunity for you to understand what cultural humility is and cultural competence is when the tables are turned and you're in a different environment. It was a really great experience for me. And students still have the opportunity to gain some of those scholarships through the public health service, through the military, through foundations, and through service obligations in underserved areas. So don't let the finances turn you away from the health professions. We can help you find and navigate that. So if you have the heart and passion for medicine and the health professions, don't let the finances get in your way. We need more people with those qualities.
And Barbara, and hopefully, Mike, you would agree that health systems and healthcare providers organizationally can help with this as well. By job fairs, by showing people what that work might look like. Because going into health sciences that our universities provide, you also sometimes have to see what's on the other side of it. Because it's a lot of work, and to Dr. Homan's point, the finances can, even though we don't want it to get in the way, they do. And so how do we as health systems be part of that workforce development by showing what's on the other side? And I know Riverside does that. I know we do that as we think about that. How do we begin to go into the high schools in a bigger way? How do we partner with the universities as we think about the workforce of the future?
This, and along with the line of cost. This is from Erwin Farrow. He says, healthcare costs are another obvious barrier for people of color being proactive in their own healthcare. How are healthcare costs being addressed?
I would say a couple of ways. One is we're trying to reduce the overall cost, create more efficient care and care that's more outpatient-based and less hospital-based. Some of the things that, Jordan and I did in medical school and residency that were always done in a hospital, now done in the outpatient setting, but also the ability, the need to actually take patients regardless of the ability to care. And I know that Centara and Riverside both do that. We take patients regardless of the ability to pay. And it's very, very important. I think that healthcare costs are very, very substantial. You don't realize you get all of a sudden $1,000 copay. The $1,000 copay is a pretty good insurance policy right now. Some insurance policies have even higher amounts. So we've got to work on reducing costs, and that starts with the education of our providers. But it's an area of focus. It's a huge problem. Totally agree.
Well, and it doesn't help when you have news stories and you have articles that are done where they talk about $15 pills for an aspirin and things of that nature, in terms of the perceptions that people have of the costs of being in the hospital and when they get their bills and what those issues are. So having advocates to help them work with them through that also may be helpful. Okay, I'm going through these a little bit quicker because we're almost out of time, and we have an important question for each of you to answer at the end of this. So this one goes to you, Austin. I think one of the biggest threats to our health in Hampton Roads is that of climate change. Hotter days, poor air quality, flooding, and other climate-related events affect everything from heart disease to pregnancy outcomes. What are your institutions doing to protect our residents from these threats? We can start there, and anybody else that wants to jump in.
Well, that's an excellent question. At ODU, we believe in science. The science is pointing us to the fact that some of our human activities really in having an impact on the quality of life from everything that we do on a daily basis. As a university, we have invested a lot of faculty resources, and we've been very fortunate to receive significant grants from local foundations to help us to establish a center that's actually going to be spending a lot of time in faculty time and doing a lot of research to help us to understand exactly how the climate change is impacting the quality of life in Hampton Roads, and also to identify specific things that we can be doing as a community to reduce the impact of climate change.
Okay. This question I think is really important that I want to make sure we get in. This is from Keith Jones. He says, too often, people who sit on boards of these organizations and who lead them are far removed from the people whom they serve. What do these hospitals do to hear voices that may seem dissonant, but may also be able to offer firsthand knowledge of communities that are otherwise voiceless? And, this is not just a hospital problem. This is an institutional problem throughout our society. But those who are in charge, a lot of times, are not the people who are served. And so how do you make sure, Jordan, you talked about the chair at the table, but how do you put a person in that chair? In other words,
Correct.
Because looking at the chair, you may see one person, I may see somebody totally different.
That's right. And so since you mentioned my name, I'll go ahead and start. But I think it goes back to a lot of what we talked about. Even at the board level, you have to think about diversity and inclusion. You have to think about your communities. You have to think about their onboarding and what role they play, and not just a figurehead, but really. So I know our board is unbelievably not only supportive, but really ask very tough questions in these areas. And they're very focused on it because they're very focused on their role as a board, knowing that they are successful in their careers, whatever, and they have to walk that line. I think you bring up a great point for all of us to think about, which is, okay, do we have to have a board seat that is filled by a specific situation? For instance, the Medicare Shared Savings Program that we are part of, and I believe, Mike, you are as well, their board requires for you to have a Medicare beneficiary on it. And thinking about those things, and how do you set your boards up in that way? And I know for Elise and Tara, that has been a major focus of ours, starting at that level, because to the point of the question, which is very correct, if this doesn't start at the top, it never gets down.
Okay. Tess, I saw you nodding your head. Did you want to add something?
No, I do agree with Jordan. And it's not just the board staff, because they're also the ones that are maybe not the big decision makers, but the ones that are actively working with the patients. So at all levels, it needs to be diverse.
Okay. Now, this final question is just before I ask you all your final wrap-up question. So this will be the final question from our audience. This is from Dr. Alvin Harris, and he says, in a time of crisis, a leader is needed. Which of you will take the lead to help overcome healthcare disparities in Hampton Roads, both rural and urban? Who wants to speak first?
I will on that one. I think that's the purpose of tonight's session. We need to weave our threads through all of these needles to be more than that we are in silos. And that's one of the lessons I've learned tonight, I think, is that we're trying to listen to the community, identify what their needs are, and there are enormous assets that we have together. And we'll be much more effective working together as teams to be able to address those issues. And we can do that through working through the faith-based communities, working through other community forum like this, and then more importantly, for the institutions to be able to get together on a regular basis and use our collective wisdom, our skills, assets, and use those as a force to be able to make change. Because individually it's difficult, but collectively the talent and the resources that are represented in tonight's participants is enormous, and we need to harness that for the benefit of our community. That's the opportunity.
I think you got a lot of great suggestions from a lot of different people, and from everyone who took the time to send in questions or to send in suggestions. So I have two final questions for you. I'd like you to answer one or the other as we go through. And the questions are this: either what is the one thing you learned from the community questions and input tonight, or how will the community input heard tonight impact your organization's next steps? So you can take one or the other. Do I need to read them again to you?
No, we got it.
We good? Okay, so let's start with Leonard, and we'll go around the table here.
Well, again, I want to thank you for the opportunity to be as a part of this and really listen to lots of great questions and conversation. I think specifically for NSU, one of the ways that this will impact us, I think, to getting to Richard's point is how do we leverage all of really the great resources that we have on campus to work more in partnership and unison with the folks who are on this call and other community organizations. I think specifically, how do we focus on making sure that we are being intentional about our outreach to students in this area, developing those relationships, like I mentioned earlier, specifically to high school students in this area, so that they see NSU as a funnel really to make an impact in the Hampton Roads area when it comes to the medical field. So those are, I guess that's where I would begin with hearing everything, and I look forward for continued conversations to really be able to take those action steps.
Okay, that is Dr. Leonard Brown, Vice President for Norfolk State University Student Affairs and their COVID Administrator. Thank you so much for being with us this evening. Austin, you can go next.
Sure. So what I hear is that we have a lot of health issues in our community, ranging from cost of care, having access to health care. And I also hear the community telling us that it's time for us to move from just talking to taking action. And I also hear from the community is that we need to find a better way to work together. No one organization can make this happen. It will require a cooperation from the institutions, from the universities, from our community-based organizations, and also the hospitals in the area to really make this happen. Again, I do agree with that. I just want to thank them for all of the very thoughtful and insightful questions that they asked to help us to formulate our next steps.
Okay, thank you. That's Dr. Augustine Austin Argo, the Provost and Vice President of Academic Affairs at Old Dominion University. Thank you so much for joining us tonight. Jordan.
Yes, so for me, both at a personal and a institutional level, it's really how do we overcome the scars of our past to build trust for the future. Because at the end of the day, that's my big takeaway that I heard. And that is being sort of touched on by everyone working together differently in ways that we have not before. How does this area act and look differently in the future than it has and done before? Because until we do that, we won't be able to build this building block of trust. And that's my takeaway, both of what I heard and how do we think about our role in that, and the role of and to challenge everybody in their role in that, which should be what we all start thinking about.
Okay, that is Dr. Jordan Asher. He is the Senior Vice President and Chief Physician Executive at Centera Healthcare. Jordan, thank you so much for joining us tonight. Mike, your turn.
Well, thanks very much for having me again. I've really enjoyed the discussion. I think that what I've learned is this great opportunity, but that opportunity to improve healthcare, particularly healthcare disparities, can only happen if that triangle of healthcare delivery systems, public health agencies, and medical education work together. I think the pandemic is a great example. Nobody believes that the health departments can do everything themselves. No one without the help from the great researchers that helped develop the vaccine or the health systems that can help deliver it. So only with collaboration amongst those three broad parts of the healthcare system can we really make progress against health disparities. And we have to listen more than we talk and act more than anything else. So I totally agree with that. So thank you.
Okay, Dr. Mike Dacey. He is President and Chief Operating Officer at Riverside Health System. Tess, your turn.
I saw a really great comment, and it sounds like everybody kind of is working on something different, maybe working on the same thing, but not really communicating. And that is, crucial and critical. Again, we're working together to fix the problem. We're working with the community to fix the problems of health disparities. I think that's the really big takeaway from tonight. Kind of not really a, surprise, but something that is, embedded into the process, which is these organizations, like Mike said, really need to start working together so that we can, see a change in our health systems and our health in general.
Okay, thank you so much. That is Tess Ledoux. She is a maternal and child health educator at the Peninsula Health District. And Richard, you're last, and I'm going to ask you to talk about your thoughts about what you've heard, and then you can go into your closing comments from there. You are muted. You are muted, sir.
I thought I'd not miss that. Thank you, though. Thanks for all the participants online at Facebook. Thank you, Ms. Ham, for your leadership as well and moderating this. This is a complicated subject. I think, I'm optimistic, I think, through this process because I know all the institutions, but the institutions are cold and sort of sterile. It's the people within the institutions are the ones that make the difference. And this is the first step. Life's about human relations and identifying ways to be able to pull people together. And I think we have the leaders of the appropriate academic and clinical organizations in this region, as well as others, where we can have common values of institutions, but as importantly, the common values we shared tonight as individuals, as human beings, because I think we all have the same objectives. I think we all have the same sense of ethics and commitment. And I think that was a takeaway that I had, that is just a very optimistic opportunity, and we need to continue this opportunity to build on this tonight's work. I would also say we may need to look also at having some of the participants, if they can give us feedback, if we'd like to have more smaller community meetings like this with the school systems, with the faith-based communities, to be able to get a better sense granularly of what their issues are in smaller components of the Hampton Roads region. This is the very large number of individuals, and if we can get it on a more personal level, that may provide opportunities for us to be able to go from words to action, like Dr. Asher mentioned and Dr. Dacey mentioned as well. That's what the purpose of this was. So I just want to thank all the participants. I leave this event tonight optimistically. And I want to make sure that we don't have this as the last conversation. This is the first of many to come as we all move toward improving the health, especially the disadvantaged communities that we all want to serve in our community of Hampton Roads. So thank you.
Thank you. That's Dr. Richard Holman. He is president and provost of EVMS and the dean of the School of Medicine. And I want to take just a moment to tell you, first of all, that if you want to have one of these more intimate conversations, please email EVMS at news@evms.edu. That's news@evms.edu. Tell us your request, and they are more than willing to come out, bring some folks from the various organizations, and have a more intimate conversation with you all. Thank you so much for giving up your hour and a half of your life to spend on this critical topic as we all try to work and do the very best that we can to make change in Hampton Roads, to make this the best place to live, work, worship, and play that we can. And I also want to encourage you to get your shots, to be patient, because the health department and the hospital systems and everyone is doing the best that they can to coordinate and bring everyone together and have you to have the opportunity to get your COVID shot. It's taking a little time, but just be patient and you will get through it. And in the meantime, even whether you've had the shot or not, the pandemic is not over. Please wear your mask when you are out in public. Please stay 6 feet apart. Please wash your hands frequently, and please stay safe. Thank you, everybody, so much for joining us tonight, and good night.